Hey guys, Dr. Harper here with Southeast Precision Clinic of Chiropractic. Here we are with our second video on myth debunking. So we're going to debunk another one for you here. The next one I have for you is a lot of people ask me, why do I have to keep coming to the chiropractor? Or rather, they feel like once they start coming to a chiropractor that they're going to have to come for the rest of their life. And we're going to talk a little bit about this and delve into some of the reasons why people feel this way and some of the treatment options that are available out there. So, number one, when you start coming to a chiropractor, when you first come in, we're going to sit down and we're going to go over a lot of different things. We're going to go over why you're here, how long has your condition been present, how is it affecting your life and your ability to do things that you want to do. And all of this stuff gets put into the plan when we do our examination, any necessary films that we need to do. We put this whole thing together and we basically look at you as a whole person and your overall health. And when we do that, there's a lot of things to take into consideration. And one of those is a frequency treatment plan of how long you need to come at what frequency to get you the best results. And you know, I always have patients come in, and when I ask them the question of, do you want your problem fixed? I never get anybody that tells me no. I always get people that says, yes, doc, I want this fixed. I want it taken care of. So it's very important to understand that when you have a condition, whether it's been there 5 weeks, 5 days, or 5 years, it is still something that the body is undergoing. It's an insult to the body, and in order to correct it, there's certain steps that we have to take to get to that point. So when we start a chiropractic treatment plan, it is very important that there is more frequency up front. And what that means is when you come in and you have a problem, we are going to start making adjustments to the spine. Now, the spine is surrounded by all kinds of soft tissue, which includes muscles, ligaments, and tendons. When those muscles, tendons, and ligaments have been very tight for a long time, and they've been wrapped around a structure that is not in proper alignment, when we start making adjustments to those bones, those ligaments and muscles are not going to be real happy with us at first. They're going to say, no, I've been this way for 5 years. I'm not moving back overnight. You know, we're going to adjust something. The body may reject that. It may say, I'm not ready to move yet. So it's very important up front that we get on top of these misalignments and we continue to check and readjust, check and readjust. That's important up front, because if we don't do that up front, we never make any headway. So the same thing would happen if you went to a gym and you said you wanted to build muscle and get in shape. If you go once a month to the gym when you start, you're not going to make much progress. If you go to an orthodontist and they put braces on your teeth and you don't go back to get them adjusted for 3 months, 4 months, how much movement do you think is going to occur in your teeth? So this is stuff that people do every day in their other facets of their life and have no issue accepting the fact that things take more frequency up front. But for some reason, when they get in the chiropractic office, it becomes a real issue for them that they have to come multiple times a week in the beginning. This is really nothing new. This has been going on in physical therapy for years. You're not going to go to physical therapy for an acute injury and they're going to tell you, okay, I need to see you once a month in the beginning. Because you're never going to make any headway. You've got to get ahead of this stuff in the beginning with the idea that as time goes by, the ligaments, the muscles, the tendons, they become more stable, they stretch, they get in a more comfortable place, and they stay longer and longer. So that's what you're going to find with most chiropractic offices is there's going to be a bigger commitment up front. You're going to have to make a bigger commitment to your care up front. And then as time goes by, things should stabilize and you should see a tapering effect on your frequency. So there should be need to come less and less as time goes by, as things get more stable. And then once they get to a point where they're stable, it's kind of like when you go and have the braces taken off your teeth after you have a nice, pretty smile. They take the braces off your teeth, but then what happens? You get a retainer, because the retainer is a very important step, because we've done a lot of hard work while you've had those braces on your teeth. You don't want to take them off and have the teeth shift back to their old alignment. It's the same thing with chiropractic care. If we work really hard on you in the beginning and we get you nice and aligned and get you stable, we can't just take our hands off for the rest of your life and expect everything to just stay where it's supposed to. There has to be a component of maintenance care anytime we fix something. So in chiropractic care, maintenance care may look like once a month. It may look like twice a month. It's individualized for each case. I can't tell you without seeing your progress exactly what constitutes a maintenance care for you, but I can tell you that yes, there is some component of maintenance care, and you would want there to be. You maintain your car. You wouldn't think of, never getting your tires rotated or changed. There is a component of maintenance to every single thing we do in life that we want to maintain. So as long as you want to be healthy and maintain your spinal correction, then yes, you will need to come to the chiropractor probably somewhere around once or twice a month for a checkup, and that is kind of where you're at with that. I would like to be able to say that I could adjust somebody one time and never have to adjust them again, but if I could do that, I would have a line of people out my door a mile long, and I would be charging $1 million for that adjustment. It just doesn't work that way. The body's not designed to be fixed overnight. We're not miracle workers. We're taking the body through a process that's a very important process, and everything that we do takes time. So I hope this has helped to clear up some of the misconceptions of why you have to come to the chiropractor more frequently up front, and why we have to maintain what we get for the long run if we really want to keep our spine healthy. And quite frankly, if we put in all that work up front, we want to make sure that lasts forever. So this has just been some information about that, and I hope you guys found it helpful, and be sure to check out our other myth debunking videos that we're going to be doing. Have a good one. Bye.